I truly believe that the key to setting a great standard and a foundation for your value-based care goals is to promote physicians having conversations with their patients. Now, what prompted this thought was I was listening to Vivian Lee's book, The Long Fix, and this is not a new book, nor is it my first time listening to it, but there was a particular excerpt that caught my attention, and I want you to listen to it.
Dr. B would sit on the side of their beds and listen to their hearts, their lungs, and their stories. He was always deeply attentive to their medical ailments, but he also wanted to find out what was on their minds. I could see him making mental notes as he asked after their families. The granddaughter's wedding. Note, have Vicky, his nurse, send a card. The husband who had just been discharged from the hospital. Note, set up home nursing visits. And the son who was moving back home. Note, invite grandson to join Dr. B's Boy Scout troop. After completing rounds, Dr. B scrawled his practically indecipherable notes in their charts, gave instructions to the nurses, and occasionally ordered a study or lab test.
Now, if you listen to this expert, the physician did a few things, whether knowingly or unknowingly, that helps the overall care of the patient. The first thing is engaging in conversation with your patient while you're checking their heart rate, et cetera, creates an environment that is relaxed and comfortable for the patient, prompting them to engage more with you and give you more context into their life. Now, that's the first thing. The second thing is it's a domino effect. Once they've engaged with you and giving you more context into their life, it can help you get a better understanding of what certain ailments or situations they're having that is causing what they're going through. Whether that is internally, how they're eating, any ailments that have happened that, were unexpected, and also how they're able to get better treatment if that's something that they need. So do they have transportation? Are they having problems with their refrigerator at home and they have medical supplies that need to be refrigerated? These type of things are being established in having that engaging conversation with their staff. Now, doing those two things does a third thing. It creates loyalty with the patient and provider. Now, these are things that we are not seeing in the healthcare system anymore. We are not seeing patients giving physicians the context they need. And of course, understandable, if you're not comfortable in the situation, you're not going to engage past what you think is necessary. And that then in turns, leads to physician hopping. We're not staying loyal with physicians, so they don't understand your full medical background. Now, the reason why I say this is because doing this sets a standard for your value-based care. And in setting that standard, you change the trajectory of the patient's care, but also the view of your practice. Of course, saying something like this can be triggering for physicians and the overall care team, which I understand. Physicians, nurses are already inundated with so much information, and charting is a hassle as it is. And on top of that, there is a workforce shortage that we're always talking about and always seeing the evidence of. But that is where digital health is supposed to take place. That is where digital health is supposed to be an additive to the care and not a substitute that many think digital health is supposed to be. Now, there are a few digital health solutions that I think are very vital to creating this standard where physicians can engage with their patients and have these conversations without being overwhelmed with the administrative task of it all. The first thing is having a dictation solution in your facility that serves as like a fly on the wall, helping to transcribe the conversation and picking out what is important and what isn't, or also allowing you to do that. And there are two specific solutions that do this that I'm aware of. Now, both of them are from the company Nuance. Nuance has the medical one, and that is a transcribing tool, a cloud-based transcribing tool that takes the information that you're talking about. It dictates everything that is being said and then takes it into the EHR. Another one that we hear about often in the healthcare industry, especially when you're in the realm of market intelligence, is Nuance DAX, or the Dragon Ambient Experience. And this one goes a little bit beyond that. It not only takes the information and transcribes it into your clinical notes, but it also ensures that, and I guess the way to say this is, with the DAX solution specifically, it is an AI-based solution. So it transcribed everything into clinical notes specifically, and then pushes it to the EHR. Now, on top of that, Nuance took the initiative to do a lot of trials to ensure that regardless of your ethnicity, this solution can understand what you're saying. And I think that is very important in today's world. We have doctors from all over the world that are treating patients, and we need to have solutions that can be beneficial for all physicians, not just a subset. This inadvertently helps the patients as well. Now, if you want to go beyond dictation and transcribing, another tool that I love, I've been hearing about this tool since 2019 when I first interacted with its founder, is CareAlign. Now, CareAlign is another solution that takes that information from the EHR or whatever clinical system you use and then disperses it amongst the care team of that specific patient. Now, I would assume this is specifically for, inpatient care where there are multiple interactions with a specific patient amongst the care team. What has been lacking in the healthcare system is continuity of care. Continuity of care and cross collaboration from the physician to the ER tech to the nurse to the phlebotomist, et cetera, et cetera. CareAlign is a tool that allows you to do that without physically having to go back to the EHR. And I think that is very important because we want solutions to create convenience for the care team and not be a burden to them. And CareAlign is one of the solutions that does that. The founder actually is a physician who has experienced the toll of caring for patients with a care team. So she understood what needed to be done. And these are the three solutions, or technically two, that I think are very vital to your digital strategy if you are looking to move towards value